including adults and children, for this past week, we remained at very high daily average census numbers. There was a record 759 COVID-19 patients on average in the hospital last week, 193 COVID-19 patients on average in the ICU, which is slightly down from the previous week, and 126 COVID-19 patients on average on a ventilator, which is again slightly down from the previous week. And Nikki's going to share a chart here around vaccinated versus unvaccinated.
One second, Director. I'm having some technical difficulties here. There we go.
No problem.
There we go.
All right, thank you, Nikki. And this chart is available now on our website. This is data from May 15th, when everyone over 16 became eligible for the vaccine, through Saturday, October 2nd, our most recent Saturday. This is information on cases, hospitalizations, and deaths, and this comes from case investigations during that time, and shows how many were vaccinated versus those not fully vaccinated. For reference, 52.6% of those 12 and older in Idaho have been fully vaccinated. As you can see, 89% of COVID cases, 90% of Idaho COVID hospitalizations, and 88% of COVID deaths are from those not fully vaccinated. Not on this chart, but for your information, 92% of Idaho COVID ICU stays are not fully vaccinated. Let me describe this in a different way. People who are fully vaccinated are 5 times less likely to catch COVID. And people who are fully vaccinated and still catch COVID are 5.5 times less likely to be hospitalized. Thank you, Nikki, for sharing that chart. As you can see from these numbers, the vaccine is effective and remains effective, in particular against the Delta variant. For those that are unvaccinated, please consider choosing to get vaccinated. The vaccines work, they're safe and effective. In addition, please wear a mask indoors and in crowded outdoor spaces. And with that, I'll hand it over to Dr. Hahn.
Sure. Thank you. Can you hear me now?
We can hear you, Dr. Hahn.
Talking while mute, it's a constant problem. Thank you. Yeah, I had 2 topics I want to make sure and cover today. One is just a quick update on our viral sequencing. First of all, we're really happy to report that our capacity has increased substantially over the summer. As you know, we've been working very hard to get an accurate picture of what's happening in Idaho. We've had over 2,800 Idaho samples sequenced since October 1st. And since that time period of August 1st, and greater than 99% of those have been Delta. And in the month of September, they were 100% Delta. So that is good to know for information purposes. And as I think the director already mentioned, the vaccines remain effective. We know they are effective against the Delta variant. And we also have treatments that we know work for people who do become ill with the Delta variant. Again, they're not 100% effective, but they do work, including monoclonal antibodies, which is one of the other topic I wanted to touch on. As I've been doing the last several weeks, I want to just give an update on how we're doing in Idaho as far as monoclonal antibodies. You're well aware that August 26th, the governor had announced that increasing monoclonal antibody use was a priority for him, and he wanted to help support increased usage throughout the state. So the good news is, first of all, as has been going on for several weeks now, Northern Idaho was our first success. Heritage Health, in partnership with Northwest Specialty Hospital, started treating patients September 15th. They have now treated 268 patients. 231 of those were at the Coeur d'Alene Fairgrounds there in Kootenai County, and 38 additional patients were treated at assisted living facilities. And we're really pleased that they have been helping to take care of patients and also really to take some of the pressure off of Kootenai Health up there. And that's just been a real success. In Eastern Idaho, I think we already announced that Mountain View Hospital was our second site that we helped fund. And they expanded their hours in Idaho Falls, and they have now provided 288 treatment courses since September 17th, and that represents quite an increase for them, more than a doubling compared if you look back to how much treatment they were doing back in August. We're really happy to see that, and they say they are on the cusp of opening in Blackfoot, their second site, so we're very, very happy with how that's going. In the Treasure Valley, we have been struggling more to get things going here. As you know, there are treatments available in the Treasure Valley through St. Luke's, St. Al's. They all take referrals from outside of their patient population. So there is access to treatment. There are some other providers as well that offer treatment, smaller numbers, but are also available. But we really wanted to continue to increase this, and we have had lots of conversations with potential partners. Some of them just do not have the staffing right now. They are too busy to take on more. But we are encouraged. We think we have a couple partners, and hopefully we'll be able to make an announcement later this week if all goes well. You all know now that the state helps allocate monoclonal antibodies throughout the state, and we're happy to say that about 30 other providers in Idaho continue to provide this treatment for high-risk patients. And we're also happy to note that since the state started allocating and the federal government started allocating to the states, and we allocate throughout Idaho, we've actually seen about an 88% increase in the amount of allocation week over week. So we've been really pleased. We think part of that is that we are using the medications effectively. And of course, with our high case rates, the federal government is prioritizing Idaho right now. So we are pleased that we are able to give more of this potentially life-saving treatment out throughout the state. Final reminder before I turn the microphone back to the director, that these are not monoclonal antibodies. While we are very eager to make sure Idahoans have access to this, this is not a substitute for vaccination. Vaccination is better. It is better to prevent the disease entirely than to try to treat it, partly because, people can still get sick with this virus and could still have some long-lasting effects even if treatment is initiated, but also because we don't know that medication will be available for every Idahoan that might need it. It is a limited supply, and we just don't want people to rely on that. So we do urge Idahoans to continue to get vaccinated rather than relying on this medication. So with that, I'm going to turn it back to the director. Thank you.
Thank you, Dr. Hahn, and we'll hand it over to Dr. Kathy Turner.
Thanks, Director. I'm going to give just a really quick update on our school testing funding and just loop you all in on how things are going. So as of today, 55 Idaho schools or school districts have indicated that they have interest in either direct funding from the department or testing kits being supplied from the Department of Health and Welfare to implement a testing program within either their school or throughout the district. And over $4 million is going to 19 organizations so far, and an additional 13 organizations, either, like I said, schools or school districts, have declined receiving funds directly, but have requested access to testing kits to assist them in ensuring that they can maintain safe in-person learning by having some sort of testing program implemented. We have ordered 25,000 PCR test kits from Vault Health that will be available for schools who would like to provide them to parents or staff. In these situations, specimens are collected at home, and then they're sent to a laboratory where the testing is performed and the result is returned back to either the parent or the staff member. But also in collaboration with our colleagues at the Idaho Bureau of Laboratories, we're working to obtain rapid at-home antigen tests that schools could make available to parents and staff, and also looking into making available some rapid PCR-based testing options that could be performed on location at schools that prefer an on-site testing option. So there's still a lot of activity going on here, but schools are indicating that they're interested, and we're doing everything we can to get them the resources they need. And with that, I will turn it over to Sarah Leeds to update us all on vaccines.
Thank you, Dr. Turner. So I want to make some comments about the COVID vaccine process and some progress. We continue to slowly get more Idahoans vaccinated against COVID-19. As of this morning, we have 793,627 people fully vaccinated against COVID-19. And additionally, since August 13th, providers have administered a total of 33,961 additional doses as either of Pfizer vaccine as either third doses to moderately or severely immunocompromised individuals, or as booster doses to people who qualify according to CDC's recommendations. And in terms of reporting additional doses, we will be adding those total third doses and booster doses as additional doses on the coronavirus homepage. The number will be displayed in a blue box alongside the other blue boxes with other vaccination totals. We anticipate having this displayed on the coronavirus homepage by the end of this week. And as we talk about booster doses, I want to mention something that the immunization program is getting a lot of questions about. And that is that there is no difference in the Pfizer vaccine that is administered as a booster dose and the vaccine someone would get who has just decided to get vaccinated and is starting the dose 1 or dose 2. It is the exact same vaccine. And then I also want to talk about a really important population of people who should get vaccinated against COVID-19. Of course, it's important for everyone to choose to get the safe and effective COVID-19 vaccine. But last week, CDC issued a very important health alert about how critical it is for pregnant women and women who are recently pregnant and women who are lactating to choose to get vaccinated. The vaccine is safe and effective for pregnant people. There is a lot of data to show the vaccine's effectiveness and safety in pregnant women. CDC's specific language for this recommendation to get vaccinated is for people who are pregnant, recently pregnant, including those who are lactating, those who are trying to get pregnant now, and those who might become pregnant in the future. CDC's recommendations align with messages from other professional medical organizations serving people who are pregnant, including the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine. Accumulating data provide evidence of both the safety and effectiveness of COVID-19 vaccination in pregnancy. We know that pregnant and recently pregnant people with COVID-19 are at increased risk for severe illness, death, and pregnancy complications. Pregnant and recently pregnant people with COVID-19 are at increased risk for severe illness when compared with non-pregnant people. Severe illness includes illnesses that require hospitalization, admission to the ICU, mechanical ventilation, or illness that results in death. Pregnant people with COVID-19 are also at increased risk for preterm birth, and some data suggest an increased risk for other adverse pregnancy complications and outcomes, such as preeclampsia, stillbirth, compared with pregnant people without COVID-19. Neonates born to people with COVID-19 are also at increased risk for admission to the neonatal intensive care unit. So we stand with CDC in the strong recommendation of COVID-19 vaccination either before or during pregnancy because the benefits of vaccination for both pregnant people and their fetus or infant outweigh the known and potential risks of getting COVID-19. Getting COVID-19 vaccine can prevent severe illness, death, and pregnancy complications related to COVID-19. Finally, I want to mention the next stages of planning that the immunization program is engaged in. We know that the FDA's advisory committee is meeting on October 14th and 15th to review the data on booster doses with Moderna and Janssen COVID-19 vaccine. And our planning is moving forward with the assumption that the advisory committee will make a recommendation to the FDA by October 15th. And soon after that, we would expect the FDA to authorize the use of booster doses for Moderna and Janssen, followed by CDC's advisory committee's review and recommendation, and a final recommendation for Moderna and Janssen booster doses during the week of the 18th. We are also actively planning, and have been since May of this year, for the recommendation of a COVID-19 vaccine for children 5 to 11 years old. And on October 26th, the FDA's advisory committee is meeting to review Pfizer's data on COVID-19 vaccine safety and effectiveness in children 5 to 11 years old. And while we don't know if there will be a recommendation after that meeting, we are planning for it as early as the week of November, first week of November. And if that timeline doesn't happen, we will pivot our planning to respond to this ever-evolving COVID-19 vaccine authorization and recommendation process. And Nikki, those are my comments. I'll hand it back to you to facilitate questions.